Hey everyone, and welcome to this special Journal Club edition of The Explainer. We're going to be breaking down all the key clinical updates from the AAC's latest Thyroid Year in Review. So what we've done is taken 14 really important peer-reviewed articles published between May 2024 and March 2025. We specifically picked the ones that are going to have a direct impact on what we all do in our endocrine practices day in and day out. All right, so here's our roadmap for today. We're going to start with nodule management, then hit that big question about GLP-1s and cancer risk. After that, we'll cover some updates for Graves and thyroid eye disease, look at what's coming with AI, and then wrap it all up with the top takeaways. Okay, let's dive right in.
First up, thyroid nodules. The whole field is really shifting here, moving toward much more precise and, thankfully, less invasive ways of doing things.
And this is the crucial point, right? Our toolbox for managing nodules has just gotten so much bigger. We've really moved beyond that simple choice of either surgery or just observation. Now, it's all about highly personalized care. Now, this really shows you the journey we've been on. By standardizing how we evaluate nodules with tools like T-rods and bringing in these incredible molecular classifiers, we're getting so much better at avoiding overdiagnosis and overtreatment. It's all about building a smarter decision tree. So when that cytology comes back indeterminate, a classifier like Afirma or ThyroSeq helps us triage. It really guides us on whether that patient is a good candidate for active surveillance or if they need a more definitive intervention. And for our benign nodules, this chart just lays out the choice we now have so clearly. A 2025 meta-analysis suggests that, while both RFA and MWA work well, RFA's precision and its slightly better safety profile might make it a safer place to start for clinicians who are new to these thermal ablation techniques.
Okay, let's switch gears and tackle one of the most debated topics in the clinic right now, that supposed link between GLP-1 receptor agonists and thyroid cancer.
This is a question we are all getting, right? And it's a huge concern for our patients. So what does the latest large-scale evidence actually tell us? So here's the bottom line. A really pivotal study by Brito and his colleagues found something fascinating. Yeah, thyroid cancer risk looked a little higher in the first year of GLP-1 use, but that effect just vanished over time. And here's the kicker. Patients on these drugs were getting way more thyroid ultrasounds. This points overwhelmingly to detection bias, not some true causal link. Basically, we're looking harder, so of course, we're finding more of what was probably already there. This recommendation is so important. It gives us clear, actionable guidance for our practice. It should really reassure us and our patients about the short-term safety of these incredible medications, letting us counsel them with a lot more confidence. All right, moving on, let's talk about some key updates in how we manage autoimmune thyroid conditions, starting with a really interesting new combination therapy for Graves' disease. So there was this randomized trial by Shi and colleagues that could be a real game changer. They found that adding a low dose of methotrexate to the standard methimazole treatment significantly improved outcomes. We're talking faster normalization of TRAP levels and helping more patients get into remission and off therapy sooner. That's a huge win. Now, for thyroid eye disease, or TED, teprotumumab is still just a transformative treatment. Its ability to reduce proptosis, the bulging of the eyes, and improve diplopia, that double vision, it's just remarkable. But, and this is a big but, we have to balance these incredible benefits with some really careful counseling about the risks, especially hyperglycemia and, very importantly, a risk of potentially long-lasting hearing loss. Okay, time to look into the crystal ball just a little bit. Let's talk about how artificial intelligence and all these digital platforms are starting to really reshape the field of thyroidology. So AI isn't some far-off future thing. It's already here, and it's making our ultrasound interpretations more accurate. But before we all jump on board, there are some major hurdles we got to talk about. We have to make sure the training data is representative, so we don't build in biases. We have to deal with the high costs, and maybe most importantly, we need to demystify that black box effect of the algorithms to really build clinical trust. We need to get past those things before these tools can be broadly adopted as a true partner in patient care. Okay, let's bring it all home. What are the absolute must-know, practice-changing points from everything we just covered? This is the stuff to take back to your clinic tomorrow. So there you have it. These are the crucial points. Integrating these evidence-based shifts, whether it's new ablation techniques, different medication protocols, or updated safety data, that's what keeps our practice on the cutting edge. And that wraps up our journal club on the Thyroid Year in Review. So I'll just leave you with this final thought. As all of these innovations move from the page and into your practice, which one do you think is going to have the biggest impact on how you care for your patients in the next year? soon.